Hello, everybody. Good evening. Myself, Dr. Isha Dewey. On behalf of Cure Health India, I would like to welcome you all for our today's webinar. Cure Health vision has always been to save lives super proactively. And keeping up with our vision, Cure Health has been organizing these webinars where we get experts from the field of healthcare coming all together and sharing their ideas and experiences to make sure that you understand your health better and stay connected with your health. Our mission is to improve the patient quality of care, patient safety, patient care adherence, and patient awareness. Our user friendly app, QurBook, has more than 3,500 care plans and diet plans under 30 health categories. These plans help our patients to improve their health condition by monitoring their vitals, their symptoms, and everyday lifestyle management activities specific to the disease condition. Before we start our today's webinar, I would like you guys to introduce to our guest speaker for the day, Dr. Abhimanyu Goje. He is the Chief Psychiatrist from the Solutions India of Mental Health Sciences, Hyderabad, and has years of experience in treating mental health cases. With a profound understanding of psychiatric disorders, Dr. Abhimanyu goes beyond his conventional boundaries, offering diverse treatments tailored to individual needs. His expertise spans a spectrum from anxiety and depressive disorder to severe mental health conditions, ensuring no one is left unheard and untreated. Thank you, Dr. Abhimanyu, for being part of our webinar.
Namaste. Thank you for inviting me, and I feel glad. I feel good, great, being a part, and really extending my help, treatment, or say information to all the viewers here. Right.
It's an honor to have you. Thanks a lot. Yeah. For today's webinar, we also have Neerja from Cure Health team. She's a care coordinator at Cure Health with a master's degree in psychiatric nursing and specializes in psychotherapy and counseling. With more than 9 years of experience, Neerja shares her expertise with handling mental health cases. Welcome, Neerja.
Thank you, Dr. Isha.
I would like to inform all the viewers that you can type your questions in the comment section that will be taken up at the end by Neerja and answered by Dr. Abhimanyu. So let's begin our session and let's touch our today's topic. According to WHO, an estimated 1 in 8 people globally is living with a mental health disorder. That is 970 million people living around the world with a mental health issue. Anxiety and depressive disorders are the most common one, and these mental disorders involve significant disturbance in thinking, emotional regulation, or behavior. Seeking help for one's mental health and addressing the issue is one of the biggest barriers that a person feels. The fear of not being able to understand others what issue they are dealing with, or even realizing that one needs mental help for their own mental health is a problem in this situation. In recent time, there has been a growing recognition of the importance of alternative therapies in addressing such mental health conditions. These alternative therapy, often rooted in ancient traditions and holistic philosophies, offer a unique pathway towards emotional balance, resilience, and inner peace. While they are not intended to replace the current interventions of therapies, alternative therapies are increasingly recognized as a valuable tool that can complement the current treatment system. In today's webinar, we'll be exploring the world of alternate therapies for mental health well-being and shedding light on their significance. So, Dr. Abhimanyu, I would like to ask you our first question. Can you please explain our audience why we need to prioritize our mental health to achieve the goal of overall well-being?
Yeah. To start with, mind is such a thing and a subject that we live with it. Without that, we are nothing, but we hardly know about it. Why? Because we are not taught, we are not spoken, we are not like, the way somebody knows a cardiac arrest, they don't know what exactly happens when you're down with mental health, because it really affects almost all the spectrums of your life, right? So that being the closest thing to me, right now I'm talking to you, if I could really listen, understand the question and then answer, that's because of my mind. And that is nothing but the projection of brain. So these two things, they are like hardware and the software, right? So right now, whatever we're doing, it's a webinar. It has to do with the hardware and the software. Okay. So once any glitch really comes in any of these things, the entire thing is affected. So mental health being the closest to any person that actually takes care of almost right from getting up and the sense that I've woke up to going to sleep and the sense that I need to sleep and I'm sleeping and all these things, right from the morning AM to night, all of this is taken care, and any of the things which really there is a dip, we don't know what to do. Okay, so that is very important. We need to understand mind has different components, say majorly the 7, if I just have to point out very quickly. That's like thinking, emotion, judgment, memory, understanding, calculation, and language. So if anything, if my mind is affected, so any of these things or maybe multiple things are affected. So hence it is very important to have an awareness, have an understanding, and overallly preserve it so that we have a better day and a healthy life. Right. So it comes to mind, as I told, it is nothing but a software and a hardware. It has to do with so many neurochemicals, which currently we are not yet so developed, in picking up what is really low or high. Like, we are successful in knowing what is my insulin level right now and what are my sugar levels. But when it comes to neurotransmitters, we are not yet so successful. There are trials, there are studies, but we are not yet. So any glitch in the hardware, we just know it at the reflection, that is the projection, that is mind. So that's how we really go about in handling the mind by using a good knowledge on brain. Right.
Okay, so that is how you have simplified the whole understanding that mental health is the real connection, how we can make that hardware and software work in the harmony.
True.
Right. So yeah, there is one big what to say, misconception or something like that when it comes to seeking help for their own mental health. There has been an issue that people feel that if they have to go out and take medication, it will have too much of side effects, or they will have to be on medication for a prolonged time, and
Right.
that sometimes hinders them to seek mental health. So can you just clarify this thing to the audience?
Right. See, as I just told you that let us make it as a base. Okay. So the hardware and the neurotransmitters, let us make it as base. So if at all we have an understanding of why the medication, the first thing, no person can really go, if suppose I'm an orthopedician, I cannot just go conduct a surgery on myself if I have a broken leg. I cannot do it, right? Even though I know. So here, when it comes to mind, and there are any glitches in that. So first, we have to consult a professional, right? So who really knows what exactly you're undergoing, okay, and who really can evaluate, who can determine the severity of it, and then see how many functions that are in trouble. Okay, so based on this, when we determine, when we conclude, when we diagnose, it is very important for all of us to know that these medications, they help you at a neurotransmitter level, whether to cut down few of them if they are getting overgenerated, or to just pump in few if they really are not adequate enough. Okay, so medications are like support. They are very, very important after a thorough evaluation and a diagnosis, but the duration of it really depends on the severity. Okay, so suppose I have tuberculosis, but what really is an outcome is cough. What people first see is that, right? So if I say, yeah, I have cough and I want to use medications for 5 to 10 days and then stop, that doesn't really work. Why? Because it's a therapy, it's a course wherein to treat that bacteria you need adequate amount of dose for adequate time. Okay, So if this is not done, then you don't see a better or a healthier outcome. So many people are afraid of the duration. They think they are supposed to take it for years together. It is not in all the cases. And just taking it for a couple of days is also not adequate. So we have to balance the duration, the dosage based on the severity and the improvement of the patient. Right?
So that's a deeper connection that goes with these medications. It depends upon the type of conditions you are suffering, and if you are the right experts to say out that.
Right.
So this brings to our major topic for today. What is the significance of these alternate therapies in promoting mental health, and how can you help our audience understand these type of therapies?
So starting with, see, any mental illness, first, it's very important to be diagnosed. If I have low mood, it's one of the components of depression. Low mood doesn't mean I'm depressed. Okay. So evaluation is very, very important. If I have, say, raising heart rate, it doesn't mean I have anxiety. It is one of the features of it. Okay. If I'm restless, it doesn't mean I have anxiety. It is one of the features of it. If I'm really getting any weird thoughts or sounds or any of these things, these are one of the components of psychosis. If I'm doing anything repetitive, it's one of the features of OCD. That doesn't mean we cannot really self-diagnose. Okay, that is not right. So when we really undergo a proper process and then it is diagnosed, then to treat, we have pharmacotherapy and we have psychotherapy. Okay, so therapy, the word comes is we are not fit and we need additional intervention for us to become fit. Okay, training is something that we are fit and we want to enhance ourselves. We want to boost ourselves more. Okay, so therapy needs a guided course, proper guidance, which has all those things to take proper care so that we don't go down. We are not dipping down. We are not going back to what we were. Okay, and there is enhancement and to a level wherein you're normal, you're able to carry out your day-to-day activities, your work, your social skill, you're socializing, right, and proper rest. So if you're able to do all of this without any intervention, that means you have attained to a normal level. And if there is a therapy which is involved, that means you're not completely fit and you need an additional intervention. So here comes pharmacotherapy, psychotherapy, and additional therapies that we will be discussing now. So this needs a proper person who is trained in that, who really can guide you step by step, who can make you understand, can give you adequate information, and then train you to use that information for your benefit. Okay, so therapy involves two things. One, you're not fit completely. Second thing, it is a guided training program, which is meant to make you fit. Right? So coming to alternative therapies, it is very important for us to know, apart from these two, what are the other ways, what are the other interventions that we really can get in so that they have an additional benefit added to whatever these two therapies are really already creating. Okay, it doesn't mean it is a replacement. Fine. If I cannot simply say my fractured leg could be treated using physiotherapy. No, it doesn't. Okay, so it needs an intervention along with a conventional therapy or say a proper treatment regime.
So I think so your explanation that you just gave also sums up my next question I'm about to ask you, that is it safe to add these therapies along with conventional therapy? So you're saying that it aids the current therapy so as we have the desired results, right?
Right. So see, it's a good question, is it safe or not? So first thing, we have to evaluate the severity of any person who is suffering.
Okay.
Okay. So if the severity is too, it is too intense, for example, then these might not be so recommended. Like few people really ask me, if say severe depression, and they really want to start off. For example, they really want to say, we want to do meditation. Would that
Yeah.
really help? For example, I would recommend not now, but a milder case of, as we treat and the symptoms are now at a milder level, then that really has a better effect and it is beneficial. Okay, so the safety profile of all these, additional therapies, it depends on the severity.
Okay.
Okay, so that is very important, and they definitely are safe when somebody guides them. There are different meditation. Many people ask me, okay, can I sit and meditate? People hardly know about it. I mean, they just think, okay, closing my eyes, focusing on something, that's it, and I want to do it. And they say after 20 days or 30 days, it's not beneficial, it's not working out. All of this is, it's just bogus, it's just for the sake of it.
Yeah.
So it has to be guided. So a person who is in it, who is trained, who knows the consequence, actually can guide you, and then you see the result. Right. So safety depends on severity and the person who is really guiding you.
Okay, and now I see Nirja needs, I think so she has a question. Nirja, please.
Yeah, doctor. So when you were explaining, because I deal with many the psychiatric patients, so when I come across, so many people ask me this, how all these alternative therapies can be, complement with the traditional mental health treatments, and in what conditions we can use this alternative therapies, doctor.
Right. So see, as soon as you're being diagnosed or you have been under therapy or treatment for whatever disorder, like, it's life. Okay, and this has to do with body and mind. So me today being fit, tomorrow, I might really dip. Okay, if my neurotransmitters really dip for xyz reasons, I might really get into any of these mental health disorders, right? So after the treatment, after the diagnosis, it is very important that we add on these things, because few things and few alternative therapies are much more approachable. Okay, they really deal with different lobes of your brain. They really can enhance few of those unexplored areas of you. In that way, that will definitely be a little more useful to people.
Yes, doctor. So I have another question. So, like,
Yeah.
as we discussed, so this need a lot of, somebody has to train it and all these things. So there are also risks involved in this when we practice this, because all these alternative therapies are not rigorously scientifically tested, and there is no, safety and effectiveness. But still, we have seen there's a lot of improvement when while we practice this alternative therapies, there's improvement in mental health. So can you please explain us what are the risks involved in this, while practicing this alternative therapies?
Yeah. Okay. So the main risks that can, the people can really come across, or we really, you might see, is there might be severity. Okay. For example, as I told you, if a patient who has OCD and really wants to get into meditation when he has severe symptoms, then the overthinking, then repetitive thoughts flashes, right? All of those things, the images, all these things might really become too severe for him to handle. That might really push him into an anxiety spectrum where it would be very hard for him to take it, and the severity might really happen, or or might really take it another course when he's already been treated. So the major risk is, without a benefit, it might really dip whatever status you have really attained over a period of time with pharmacotherapy or psychotherapy. So it's very important to preserve whatever we really are gaining and not to just lose it, just trying to intervene something without a proper guidance. Yeah.
I hope Nirva, you got answer to your questions here.
Yes, Dr. Isha.
So thanks for that, Abhimanyu. And Dr. Abhimanyu, I think, the answers that you just, explanation that you are giving us, it's quite enlightening to, join it towards the right kind of understanding. So now I would like to steer this discussion towards few of the therapies that I would like to understand from you. The first one comes that in recent times we are seeing music therapy is increasingly advised to, reduce anxiety and stress and even sometimes pain in post-operative cases. So can you just explain the science behind how this music affects the brain and emotions in the context of therapy?
Yeah. So before I go a little deep, I would just like to say how many of us would have seen like horror movies, few of them even like. But can you imagine enjoying a horror movie on mute? We don't,
No,
right?
certainly
It's
not.
absolutely, it's pointless. You don't get the feel at all.
Yeah.
So with this example, I would like to throw some more light that the music, right? The sudden scream or any of those sounds really intensifies our emotions. And that's what we really like or we don't like, right? Somebody hates these movies or somebody really loves. Why? Because they want to have that emotion, and that's purely because of few visuals, but more of audio. Okay. So nobody would really love to watch a horror movie on mute. In the same way, as we know, and if we really go culturally quite into our past, we know that so many of us used to practice music, would make our kids learn music. There are different ragas, if we know, in Hindustani music, which has a significance on our emotion. Okay. So this is one of the very important, sensory organs that we really sense our surroundings. And based on that, an emotional status is attained. Okay. So the different ragas are practiced at different times because light has another effect. Okay. Our day-to-day activity has another effect, and the hormones that are released on different times of the day have another effect. So syncing sound or music with that is very, very important. And they have known it over a long, long, like, more than decades or centuries, I would say. So it is known fact that music has a very important effect on our emotions, and mental health has a lot to do with our thoughts and emotion. Okay. So whenever we have say recently, like the Western side, if we see, we have Mozart, and that music is being, I don't say proven, but is seen to enhance your memory. In my own childhood, I attended few, memory enhancement classes, like, and I was made to listen to Mozart music, right? I don't know how that really helped me, but it definitely had some effect. So knowing what music, which kind of music is really gonna involve into your emotional status and your thought process is what is very important to know. And you need a therapist who really can differentiate. Okay. And the other studies have proven that when you hard rock music, if if I'm not wrong, like say 10, 12 years back, there's a lot of hard rock music that people used to listen. But we have seen a very bad effect of it. Okay. People have literally got hampered with their mental health. People have gone into severe depression, have gone into psychosis, and all of it happened because of, again, the music, right? Which is not recommended. So it, as a therapy, it is very useful, definitely. And it is much more useful when the severity is, like, not so high, when we have mild cases. And it definitely soothes a person, it changes so many things. And the neurotransmitter levels are also altered as soon as you hear certain sounds and music.
Okay. So the connection that you just mentioned, it's really important that we are able to understand that there is a mental health issue, and if it's in the milder state, we certainly can use these therapies to have a conclusive, results to it.
So, and adding few points to it, like, music also has a connection with your memory, right?
Yes.
The minute, like, if I really, any of the old songs or any of these things, the minute you hear the tune of it, then you go back,
Yeah.
you go back into the time, and then you are instantly connected. Okay, so whatever stress, suppose you were undergoing, it really takes you into a time machine of your own. You go back and then you recall, and then you have a certain smile. I remember a few of these, songs listening to while we used to go on drives when I was a kid. So the minute I hear those songs, I really recall and those memories. So it is very important that it has a deeper connection. Okay, and it really can be used for healing people. Yeah.
Okay, so now the connection is really strong over there than I mean that it feels. So if the music has such an impact, and you just mentioned the memories also, involved in it. So do you think we can integrate such kind of music therapies into hospital settings, or schools, as well as in corporate settings? Can that help?
Yeah, definitely it can. No doubt about it. But it has to be in a systematic way, right? As I would say, pharmacotherapy is very important, but it's not for everyone, right? In the same way, in hospital settings nowadays, if you see, there are good number of hospitals, that I see where mild music is played in the background, so that people don't feel it to be, there's a rush, or I'm into a zone wherein there's a lot of, hurry burry and all of it. So they are made to get occupied in one of their senses, right? So that they really are soothed. We go to different, say, I mean, it's an internal thing, when I was an intern, and I remember a few of the surgeons would really play music while doing an operation. Why? That really would really improve their focus. Okay, it is not only for the patients, that really helps even the doctors actually. So it's been used, but not at a larger scale. But yeah, that really can be done, should be done, I say.
That is something that we should be experimenting in the coming time, and certainly I feel that it is picked by, and we can help these people who are really in situations that can lead to some issues, because we do see mental health cropping up in younger generations, in corporates. So
Yeah,
these music therapy can certainly help. so
definitely.
so now I do feel music cannot just be as a hobby, we can also keep it as a mental health tool, and thanks for that, and I'll making sure my daughter is listening to Mozart. So now the
Yes.
next, so the next question I would like to ask you is another therapy, or another, ancient practice that comes from India, yoga.
Right.
Apart from the physical benefits, the incorporation of meditation and yoga-based breathing practices are known to improve one mental health well-being. And we're now celebrating International Yoga Day. So do you
True.
think, how can this yoga be connected to mental health, and how can people benefit out of it?
Yeah, this is my, well, I have a lot of connection to it, and that I have a lot of interest in that, not just from the recent times, but since my graduation I have started exploring the spiritual side. And yoga means, as we all know, the definition, that is, say, union, or like, say, compatibility, and just knowing the world, inner world, right? Not the outer world. So what am I? If I really experience myself as a soul, then what is my body? Okay. So these things are very deep. But as we start with few of the basics, okay, it is very, very important to know, and to know how to connect, and then how to disconnect as well. Okay. The problem with kids and others that we nowadays see is they cannot disconnect once they're connected, or it is very difficult to connect to another thing once they are connected to something else. Okay, so yoga definitely teaches us, it takes us inward, it takes us into our own world, Okay, what am I? How my thought process is? What are my emotions which really are coming up? How am I reacting to it? How am I understanding things? How my judgment is really taking me? How am I calculating? My memory and all of it, the 7 major points that I told you in the beginning, they really have a deeper connection inside. And yoga definitely takes a person, a better control and a better sense of well-being. Yeah, this is me. Okay. So, personally speaking, yeah, yoga and spirituality has a deeper connection to our mental health and well-being of this mental health has, it involves many aspects of yoga and meditation. Okay. So when it is guided properly, it took me 8-9 years to gain some control when I've been practicing. And it is not like you just start and you just gain, because it is very deeper. And we are very much disturbed, we are very much occupied by the external world. So it is very important for us to give it some time, okay, first to understand, then reach out to somebody who is an expert in that, who really can take us in, and then we really can enjoy and preserve our mental health.
So thanks, doctor, for that, making us understand yoga's connection. I do feel, Nirja, you have, I would like the audience to know about a case that Nirja had, taken and how yoga helped. So Nirja, can you just explain that in
Uh,
brief?
Yes, yes, Dr. Risha. Thank you so much for raising this question. So we had a user who is having OCD. So he was under treatment almost since 7 years, but nothing was working out. So he used to take the medicine all 7 years. Then later on, he enrolled into Cure Health, and we started talking to him. So understood and told many methods to him how to overcome those anxiety symptoms and all. But one day I've suggested him to do this JPMR, yoga, meditation. So many suggestions has been given. But he has expressed that there's a relief from doing yoga for him. So he, after that, like initially he was not able to do it consistently because he doesn't know properly, and even I am not specialized in yoga. So as you said, the one who can understand the spiritual and philosophical way of living, so I mean those persons only can practice this yoga consistently. So he is one of such kind. So he just went into many yoga centers, and he started researching what yoga helps him to deal with OCD. And also then finally he enrolled himself into Kundalini yoga, so which helped him a lot. And then slowly he has seen a lot of progress in his anxiety symptoms. He was free of symptoms, and he said, in fact, with I mean, than medicines, yoga is giving him a lot of relaxation. So that was a very good example, and even he's still associated with us with Cure Health. He's continuing the treatment. So that was a very good example. I could take it here. And also, doctor, so as we discussed about yoga, so I just have another question. So there are herbal supplements which can be used in mental health or treatment as well. So what are the side effects of this herbal supplements? So do they have any side effects, or how it will be done?
Yeah, if the question is very precise, do they have side effects, like, then that really puts me into a big trouble. Why? Because see, first thing, I have done my allopathy medicine. Like, I finished my MBBS and then MD. So I don't know much about it, to be very frank. Okay. But they do have first good effects. But the side effects, if you really ask me, I would say it is because of the quantification. Okay. So if you really grow 5 plants, you don't know how much of it really one of these plants has really taken up or has produced. That is where, until it is an extract, we don't know, we cannot quantify it. So the side effect profile might vary into a larger spectrum. Okay, this is what is my understanding. And to the question, if they have a side effect, okay, so I'm a little sorry because I might not be the right person to comment a lot on that, right? But yeah, the quantification and the quality check and all of it, they really have to do with the side effect profile of not just herbal medication, but any of the medications that we use. Okay, so I would say, until it is much more refined, until much more research is done, or the extracts are being evaluated, I think we don't know yet. But yeah, the side effect profile might increase, which can be decreased using few of these techniques.
That clarifies, these herbal supplements that do need some scientific, backing as well as expert understanding. And yeah, they may vary into their effectiveness as well as side effects. So thanks for that. So now, doctor, just, turning the wheel towards, little bit more interesting therapies and a little bit more into the technical aspects. So mindfulness-based stress reduction and mindfulness-based cognitive therapy, MBSR and MBCT, are widely discussed approaches to improve mental health. Can you please elaborate on these approaches and make it a little bit more understandable to the audience and the viewers?
Right. So if we start with stress, what is stress? Like so many, it's the most common word used nowadays. Everybody says, I'm stressed, I'm stressed out, I'm burnt out, and all of it. Suppose you have a parameter and then you're made to work only in that, and that really is getting shrunk. That means you now want more space, you want more breathe, right? And that really puts you into a timeline as well as an outcome wherein you have to overperform. Okay, so I would say pushing the door is okay, you are performing and there is an effect of it, but you just push the wall, you're performing but there is nothing which is happening. Okay, and that the second scenario of pushing the wall definitely increases stress on you. So there is no outcome, but you're simply trying to do it. So when any person is undergoing stress, it can be because of two things. One thing, he does not have proper information of what to do and what not to do, and how to do and when to do. Okay, that has to be with involving some training. Okay, and the second thing is key, if suppose he knows all of this and is unable to cope up, right, then how do I really understand, or how do I reduce it in given circumstances? Okay, so suppose I okay, a typical day of mine, I get up, right, there are calls from hospitals, like for ICU consultations. Then I go to my hospital, I see cases, I interact with patients. Then there are meetings with staff. Again, there are interactions with the family members. Then I have to drive. Then I have to come back and see my OP. But if I say I'm stressed, that means what? I'm unable to categorize these things. I'm unable to properly put out my energy into different categories that I have to work in. So everything is mixed up. So if I'm just trying to talk to a patient, and if I am thinking about the staff meeting which is about to be there at say 2 o'clock, that means I'm trying to do two things at a time, which is not required. Okay, so if I'm mindful, that means no, I'm with the patient, I have to first give priority, I have to be here completely, and as soon as I'm done with it, that thing can be taken up, right? So being mindful is being aware of your thoughts and the current thought, whatever you really are getting or generating. Okay, so this mindful techniques, mindfulness definitely helps somebody improve their mental health, reduce their stress level, understand what exactly is stress. And there is a major chunk of memory recall. We just don't recall, we relive. Okay, suppose somebody has told something to me, say 2 days back, and somebody did not, appropriately behave, then those things would just be carried as a burden and a luggage, which I would just be thinking always. So being mindful, okay, that thing is done. Okay, it's been now 2 days. I need not think about it. It's not going to fetch me anything. Neither the person is here nor I'm there with the person. Okay, this thing will definitely help me come out of the stress, come out of the past that I'm just roaming around. Okay, and this way mindfulness definitely helps de-stress yourself, understand what is happening, and knowing your current thoughts. So once you know, you have a better control, you can alter those thoughts, you can guide them yourself, and then you can attain a sense of peace.
Okay. So talking about another therapy after understanding how mindfulness is important, I have been listening to this therapy, bright light therapy, as a very promising non-pharmacological treatment for
Right.
for a range of psychiatric conditions. So do you think, what is this light therapy and how does it help in improving mental health?
Yeah. So just to tell you a basic thing, how do we know if it's like the morning? How do we say this word? The morning has come only with the light, and the night is because there is no light at all. So light has a deeper impact on our hormone system, right? Our immunity, right? Our wakefulness, our activity, and all of it. So, and the major, I mean, the only organ that really can sense light, perceive light, and tell to our mind is vision, right? So it is very important to know that light has an impact on our hormone system. Okay, so if at all, say for example melatonin, if there is a lot of over secretion of melatonin or production of melatonin in the daytime, then the person is bound to be a little lazy or sleepy. Okay, and if there is no production of it in the night time, then you have sleeplessness, which so many of us are nowadays experiencing it as a very major problem. Okay, so light really has an effect on it. So if we use the bright light therapy in the morning times, right, because it is quantified. Okay, it is not that I just turn on my light and then just go simply sit in front of it. It is quantified. Hence again, I'm just brushing it up. Therapy means somebody who is an expert in that and who is in a controlled way is trying to make you undergo all of that. Okay, so in the daytime, when we really are exposed to certain amount of light for a duration, then all these hormones can be reset. Okay, so that we understand, the body understands this is day and I'm supposed to behave in this way. The hormones are supposed to be secreted in so much an amount, so that we sync with it, and the alertness is improved in the daytime, and the quality of sleep is improved in the night time. So nowadays it is coming up and it is very important. And hence, say traditionally they used to say as soon as you get up, you really need to go get exposed to sun. Okay, and then they have made it into a cultural thing, but that we have been practicing, right, which has a very major impact on our life.
Okay, so you mean to say these, cultural things do have some scientific, evidence behind it. So we need to listen to, our grannies, I believe then.
Yeah, and really think about, it has to be logical.
Correct. I do agree to that. There needs to be certain logic. So now I would like to, touch a little bit of the artistic side of these therapies. I do listen to researchers showing that art therapy is a very powerful and innovative approach that allows individuals to express themselves, their inner thoughts and feelings. So are these established art therapy techniques or exercises that individuals can do, and what significance actually these therapies have, so as a person should follow it?
Right. So just to start off with, like, say, music, art, okay, all these things were incorporated since the childhood. I mean, if you really look, okay, why it is very important is the dominant side of our brain says, if I'm left dominant or the right, the other side of it really controls, one of the sides controls the, say, logical calculative side, the other one is the creative side. Okay, if I'm lying, that is my creativity, but I'm knowing how much to lie, that is my calculation, right? So both these things are supposed to work, otherwise it's a mess. It's just an example. not. So it is very important for anyone to explore their artistic side. So the creative side, you have a lot of space for that. I myself am into photography. I love it. I practice it. I really recommend so many of my, say, patients to really go for art therapy, wherein art involves so many aspects. That is not painting, it is painting. Music is also into art. Okay, photography, creating something, sculpturing. Okay, all these things really take an other side of your brain, which you probably might not while you're doing other activities of the day. So it is very important for you, all of us, to know that these things are supposed to be explored. They give you a space to express. Okay, the therapist can know what are the inner emotions that you're undergoing, and how to really guide you so that a better form of it, a color, right, the texture, the shape of it, all these things have an impact on you. And when you are into it, when you create art yourself, it gives you an inner sense that, okay, I really can create something which did not exist before. Okay, that also gives people who really are suffering with, say, any sort of a mental illness, it really boosts them up. Okay, no, I have something in my hands to create, and people like it. So it is a very important form of it, and it has a very good impact in really treating patients.
Okay. So I do feel, the connection to art, and as you told how the right and left side of your brain is, and you have been very kind to make sure, how you need use your creativity when lying. So that's something that will certainly help us people to connect to, how art can help you in your mental health. So my next question comes, and I think so there are many people who would like to understand. I am a pet lover, and I know the feeling of coming to the house back after a stressful day and having your pet waiting for you, wagging his tail, and then it goes off. All that stress goes off. So, and for centuries, pets have shared an extraordinary bond with humans, and animals do provide comfort, support. So what is this integration between these pet therapy and mental health?
Yeah. So okay, to be a little frank, we've always been influenced by the Western world. Okay, I mean, whatever happens there, we feel okay, that is much more scientific and good. Of course, because there's a lot of research which is being done, so there is a good amount of significance to whatever papers have been published. But let me tell you and add this point: okay, nowadays Indian cows, okay, who are the desi cow is being transported to so many different countries where cow cuddling is charged. Okay, it's really charged. I mean, I was stunned. $50 to $100 per hour. It's only to cuddle the cow. Okay, so I was like, oh, that's good. I mean, at least that is really helping. That is helping people understand animals are an integral part of our life. Okay, in a better way, in a better sense. Okay, so cow cuddling, as if anybody's interested, can really go into some of the literature, but it has a significance. And another deeper connection to it is the way we are, we are a little calculative when it comes to connecting with a human. But when it comes to an animal connection, it's purely emotional. Why? Because they have certain activities that they do. They always want our attention. They always want to be with us. And that sense really makes us feel, okay, yeah, this is me, and there is somebody who really needs me and wants me. Okay. So in this way, the love with the pet, having pets, but again, taking a good care of them is very, very important. Okay, not just having it just like that, but yeah, so these things really improve your mental health. They really make you feel, they really make you get the feel of being they connected to something without much of give and take. They're connected to you because you're there for them. Okay, this sense is very important for people who really lose mental health or have a dip in their mental health. So it is it is important and it has a good significance in, treating patients.
Yeah, and I do hear, with pets, you do release those good hormones that certainly help you in repairing your mental health as well as things. So with that, I think so, Nirja, you do have one case study that involves a pet therapy, right, Nirja?
Yes, Dr. Isha. So, Dr. Abhimanyu, so we had a teenage girl so who was studying on international board. So
Mm-hmm.
she was having a lot of pressure and stress, and her mother said she was not talking too much nowadays, and she was being moody, and she suddenly gets aggressive, anger,
Mm-hmm.
and also she said, like how much ever I study, so I cannot go to the next level. So that was her thing, and she finally lost her interest in gaining marks or scores in school.
Mm-hmm.
So in this case, so we suggested many things to her, and as well, I never spoke to the user, because to the teenage girl, because she never spoke to me.
Yeah.
Only her mother was the one who was giving me the information. So
Mm-hmm.
then I told her many things, but when whatever I see, her mother used to say she doesn't have time. She doesn't have time to study itself, but she can't do all these other things. So then slowly, after a month or after 1.5 months, so I suggested her mother so to just bring a puppy to their home.
Mm-hmm.
So then after a month of bringing that puppy to their homes, this girl started, there was a change in her behavior. She used to be like more happy, without being moody and all. So she started talking. And later on, she started talking to me as well. And she was sharing her experiences, what was happening in a college. So all those experiences were shared to me, and we guided accordingly to her. And so then slowly she brought another puppy, so which is of her choice. So she
Mm-hmm.
likes fishes so much, so she bought a fish as her pet, and she learned how to diversify her schedule and give importance to her as well. So this was a good case where animal therapy works, as you said. So animals doesn't think as humans, like, they don't have critical kind of a thinking. They change according to the situation. So that was a best part of animal therapy, so where we can suggest for many patients.
So that's great to know that that pets do have that kind of effects on people.
Yeah.
So thanks, Neerja, for that. Now, doctor, I would like to ask you some unconventional therapies now. The first question comes, there is a very new concept, I think, so there is going on, and huge craze among youngsters, rage rooms. The rage rooms are getting a lot of attention where you can go break things, yell and scream. And scientifically, it's called as primal scream therapy. So what is exactly this idea, and what is becoming, a craze among youngsters? Is it good? Is it bad? Or does it have any importance? Or frequent use of it can cause some other reactions? So, little bit of understanding from your end.
Yeah. So I don't really agree with the thing ki if you really express your rage as much as possible, you really get vented out. Till
Yeah.
here it is there. But this is subsequently gonna really put you out of it. No, that is gonna actually build up more, say a pattern in you, that you have that accelerated thought,
Mhm.
you get the rage, you really want to vent out, and you don't know what to do, and you really land up breaking things. Okay. So for me, I mean, my say would be key, it's not so healthy. It might not have a good consequence, because you're training somebody to externally show the rage.
Correct.
Okay. Instead, if at all we understand, we really guide them to understand what exactly is rage. Okay. And how you really can control it at a thought level, and not completely vent out and bring it to it till an emotional level. That might be a safer way, that might be a much productive and a better way. Okay. So that they really get a sense, and even if I feel like breaking things, no, it is only at a thought level. I know I'm mindful, I can just stop the thought, deviate myself, and make myself safe for me and even others. And this technique, I have used it personally and to my patients who have a lot of self-harming behavior. Okay.
Mhm.
That is very much useful. Now they themselves, they confess, they say ki now it is at a thought level. Okay. So it's been almost say 5 6 months before, when I told them ki I would guide you eventually wherein you can control it at a thought level. They said, is it even possible? I don't even think it is possible. But now they come up, they say, yeah, now I understand what you told, so many months back. Now it is at a thought level I'm able to control. So rage and all of it can be controlled, which needs a good training. And I don't agree to having such kind of a setup wherein I feel it is not healthy at all.
Sure. So, your takeaway is, it's not a good practice of, trying to attain a mental, balance by going to these rooms, because the way
Right.
you explained that, like how rock music had a bad effect later on, this can also have a bad effect.
Yeah.
So yeah, that I understand now. So, as we are moving towards, the end of our session, before, we move. So what are there any practical, tips or takeaways that you have for our audience to make sure, their mental well-being is preserved and acceptance of these alternate therapies?
Right. So because I would say something is too close, you don't know it is with you, right? So you have to separate yourself with it a little, right? So that we get a better understanding. Okay. So you need to understand that mental health is a very integral part of you, but because it is so close, we don't know if any changes which occur, we just think is something else is the reason and not this. So start off with an understanding of mental health. Okay. Start to know yourself with the mind and body, and not just as an integral thing, as a unit. If you can demarcate things, then you can understand which spectrum has an issue and how to address it. That's very important point that I would like to say. Second thing, as soon as if you sense any difficulty, reaching out to any of the professional person, any of the professional, who is really practicing since a long time, really helps you understand, save time, save your own energy, and recover as soon as possible. That is very, very important. Third thing, do not take it for granted without doing anything it is preserved. No, it is not. Okay, suppose I have anger issues, for example, I have to work on it for me to eliminate that. It cannot just go off as my age increases. So it is very important that we have to work after we find things, and not just the therapist, not just the medications. It is your contribution that really helps you recover in a better way. It's not a surgery that the surgeon comes and does and just leaves. You are also an important part of it in contributing for the better or worsening it, right? So understand these things and practice them, which is what is going to really give you inner peace.
I understand that. So, that that phrase inner peace is really much important, and I do feel experts like you can help, these people who have the issue. So, as we're running out of time, Neerja, can you take any one specific patient customer question that you have from the audience?
Yes, Dr. Isha. So, Dr. Abhimanyu, so as you said, so definitely I agree with your point. The people has to separate them from themselves to see them as an individual and what are their problems they are happening in their mental health. So it is definitely a point, and I also suggest many of the patients in a same way. And there was one question which audience has asked. So, what role does nutrition play in mental health and alternative therapies?
Yeah. See, the first point, as I told you, hardware and software, and the nutrition has to do with your hardware. Okay. So if we really eat something which is very healthy, right, our hardware is taken care, and the projection of it is better. Okay. And if we go a little deeper into spirituality, I mean, there is something called Sattva Rajatama. I don't know how many of you have really heard of it, but it is the basic particle if we really divide. So it has an influence. So if at all our nutrition level is not up to the mark, we are not taking adequate supplements which are required, and I would recommend to go for as much natural as possible. Okay. Don't go for something which is extracted and then sealed into a capsule and is given to you, because freshness really has an impact. the bioavailability really improves, the body can really take up, and the side effects of it are absolutely minimal. Okay, so nutrition plays a very, very important role in keeping the hardware the way it should work, and then automatically the projection of it will definitely be smoother and better.
So that's rightly said, I believe, the connection of nutritional aspect to mental health. So I think so. This brings us to the end of the session. And Dr. Abhimanyu, a very big thanks to you. And I was able to understand many things, and that too in a very simpler manner. And that sometimes we don't expect when we go to, a psychiatrist. We do feel it will be, much more intense to us. But thanks for that. And it was great understanding things and getting your valuable insights on alternative therapy. And I'm confident that today's audience has gained a lot of knowledge and understanding about these therapies, and we were able to explore many because of your patience and your timing. So, dear viewers, to avail the benefits of our care plans and diet plans along with our care coordination services, please download our QurBook application. We have introduced our care plans and diet plans for mental health as well, and especially for patients who have disorders like depression, anxiety, insomnia, stress, and eating disorders. And we do provide counseling sessions and customized plans. So do make sure you are able to explore the application, and we will be very happy to serve you. Thanks a lot, everybody, and have a great evening. Thanks a lot, Dr. Abhimanyu. Take
Thank
care.
you. Thank you. Namaste to all. Thank you.
Thank you.